ಮ್ಯೂಟ್ ಅಲ್ಲಿ ಇದೆಯಾ?
Namaste, Rasoushadis sir.
Yes, recording has started.
Yes, please go ahead.
Om Dhanvantre Namaha. A very good afternoon. All Vaidyas, welcome once again. I am Dr. Geeta Pottur. Today we are conducting 41st webinar series. So we'll start the session with the Dhanvantri Stotra by Dr. Geeta Jaiswal. Welcome, Dr. Geeta.
Thank you, Geeta ma'am. Om Namo Bhagavate Vasudevaya Dhanvantaraya Amrita Kalasha Hastaya Sarvamaya Vinashaya Trailokya Nathaya Shri Mahadhanvantari Namaha.
Thank you, Dr. Geeta. Now I request ma'am, are you there, right?
Yes.
I request Shakuntala madam to brief about our ROS group. Welcome, ma'am.
Thank you, Dr. Geeta. Thank you so much, Satyanarayana sir, because you have given your time. I know you are very much busy, and you have taken your time to share your knowledge in our ROS group. I welcome you, sir, to the ROS family. Well, I welcome all the delegates who are joined for this wonderful session. Behalf of ROS team. ROS is Rudra Arbuda, Ayurveda approach under one shelter. So when we are talking about ROS, what it does? So ROS is mainly concentrating on Arbuda related issue, related treatment. It could be treatment. It could be a knowledge sharing, and many more activities like cancer awareness in the public. So we have done many cancer awareness programs from our ROS team. And even though along with that, we have done cancer screening camp from our ROS team throughout India. It's not only restricted to ROS, is not restricted to only Karnataka. Throughout India, we have done the camps, and along with that, we are ROS family 16 from 16 states, and I am happy to announce that we are more than 550 members from ROS team. And along with that, we are conducting 2 classes from each week, and one class is specifically about it's about yogas. One from Rasatantra Sara was Siddha Prayoga Sangha, and one class is about totally about cancer. So like that activities we are conducting, and I hope you will definitely get knowledge from sir, because sir is having abundance of knowledge. And I once again thank all of you for the joining this session and welcome you back. And I will hand over this session to Dr. Geeta Pottur.
Thank you, ma'am. Thank you for the introduction. Now I request Dr. Nayana to introduce today's speaker. Welcome, Dr. Nayana.
Good afternoon, all. It's my great pleasure to welcome you all to today's webinar on application of multidimensional Ayurvedic treatment in the management of cancer. It's my privilege to introduce our esteemed speaker, Dr. Satyanarayan sir. Sir has completed his BAMS from SDM College of Ayurveda, Udupi. He has completed his MD in Vaishajya Kalpana from IPGT and RA Gujarat Ayurveda University, Jamnagar. Sir has specialization in field of Vaishajya Kalpana. Presently, he is principal medical superintendent and director of research and development at Munial Institute of Ayurveda Medical Sciences, Manipal. He has 26 years of work experience. Along with that, sir worked as lecturer in subjects like Rasoushadis and Vaishajya Kalpana for both undergraduate and postgraduate students since last 24 years. He has been guide to PG and PhD students. Presently working as R&D executive, MR for ISO in an Ayurvedic pharmacy at Munial Ayurveda Research Center, and actively involved in design and development of Ayurveda formulation, quality control of Ayurveda medicines, research on single herb and herbo-mineral preparation, clinical research in Munial Ayurveda Hospital under various Chikitsa Kalpa. Sir has published more than 20 research papers in national and international journals. He is also a reviewer for 4 international journals. He is also a editorial committee member of 2 peer-reviewed journal and co-coordinator editor for textbook committee RGUHS Bengaluru. He has presented more than 75 papers in various national and international conferences besides chairing the scientific sessions. Sir has honored with multiple awards like conferred with Edward Kennedy Memorial Award to the best presenter from the senior research category. Shobita Memorial Award and also Best Paper Award in Colombo, Sri Lanka on GARI International Conference. Sir also held few more positions like former BOS member Banaras Hindu University, member of Ayurveda Subcommittee, Pharmacopoeia Commission for Indian Medicine, member IEC of 3 IEC and chairman of 1 Institutional Ethical Committee, member of Doctoral Research Advisory Committee, NAPOYA deemed to be University Manipal College of Pharmaceutical Science, JJT, University, Rajasthan. Sir has special interest in research in the field of medicinal plants and herbo-mineral formulations, quality control of herbal and herbo-mineral formulations. Today, Sir will shed light on application of multidimensional Ayurvedic treatment in the management of cancer and will provide valuable insights and perspectives that will undoubtedly inspire and inform us all. I encourage each one of you to actively engage with our speaker today in today's presentation, to ask questions and to participate in the discussion that follows. Your involvement is essential in making this webinar a truly enriching experience for everyone. Without further delay, please join me in extending warm welcome to Dr. Satyanarayan sir. Sir, we are eager to hear what you are sharing with us today. Thank you so much.
Thank you, Dr. Naina. Sir, stage is yours now. You can start the webinar. You can share the slides, sir. Now I request everyone to mute the gadgets to avoid the interruption in between the lecture. Please mute the gadgets. If you have any queries, you can WhatsApp, you can post it in the inbox. Welcome you, sir, once again.
Thank you very much. Yasmin sarvam yatah sarvam yah sarvam sarvataschayah yasya sarvamayo nityam tasmai sarvatmane namah. Rogan asheshan apaham situshta rushta tukaman sakalan abhishtan tvamashita hi ashrayatavam prayat. Good afternoon. Thank you for joining me today. At the outset, let me extend my heartfelt thanks to all of you who are here, to Dr. Shakuntala Patil and her team on ROS. It's a great pleasure to be with all of you who have dedicated yourselves in disseminating awareness related with cancer. A global issue, a burning clinical problem. We are seeing the cases getting increased day by day, despite so many advances in the field of modern oncology. This is one of the rarest of organizations that I am witnessing today, and let me congratulate for all of your efforts and my best wishes with you. And the title of my presentation today, as you can see, is Application of Multidimensional Ayurvedic Treatment in the Management of Cancer, where I will be incorporating a few of the case studies at the end. So I have added clinical experience. Probably I will be focusing on application of Rasoushadis today, as the topic is very wide and vast. Within the time frame, let me try to limit myself. I may be a bit quick. Please forgive me for that. This presentation will be having 2 parts. In the first part, we will try to understand what are the options under Rasoushadis that we have which can be effectively used in various types of cancer. And in second part, I will be giving a short account of an US patented multi-dimensional approach that we have designed in our institute about 20 years ago, and the integral part of this program and some clinical outcomes. So with this background, initially a few customary slides. I know that this platform is not for much academic discussions, but however, to make the presentation complete, a few basic slides I will quickly run, and then we will focus on to the application of Rasoushadis and multidimensional treatment in cancer management. So when we speak about the incidence of cancer, you will find so many available literatures, publications. One interesting observation that I found was cancer burden of our country increased dramatically in last decade. The title of the presentation says, cases and deaths increased last decade, COVID-19 widens screening gap. This is absolutely true. We have observed that those patients who were on their regular visit to oncology clinic were asked not to come to the hospital until and unless it is very emergency. So they were asked to continue their existing treatment, or so they had been given some telecon. But unfortunately, as all of us know very well, cancer is a very silent disease in some of the occasions. The metastases have occurred, disease got advanced, and when post-COVID they approached hospital, situation was very grave. So this is one of the reasons why cancer case increased by 21% and deaths by 26% in last decade. However, there are many reasons why cancer incidences are increasing, starting from the dietary habit up to lifestyle and environmental pollution. It was seen that cancer cases in our country increased at an average annual rate of 1 to 1.2% between 2010 and 19, and death rate also increased by 0.1 to 1%. The growth rates are among the global highest. In entire globe, cancer cases are increasing, but in India, it is global highest. And this is the analytical report by IHME published from University of Washington School of Medicine in JAMA, and it was published on 30th December 2021. As per an estimation in 2020, around 13,92,179 people in our country had cancer. And as per a projection, by the end of 2022, that is 2 years ago, it was expected to be 14,61,427, a crude rate of 100.4 per 1 lakh. And the prediction is so alarming that 1 in 9 people are likely to develop cancer in his or her lifetime. And when you observe all these incidences, probably lung and breast cancers are topping the chart in males and females respectively. If you see this picture on this side, we are seeing various types of cancer spread across the country. Probably to some extent we could correlate them with certain causative factors. Say in Northeast, if you take the example, what highest cancer rate, especially CA of esophagus? Probable reason would be tobacco, household burning of firewood. If you see in Goa, higher incidence of colon cancer is observed, most probably because of red meat, alcohol consumption, and tobacco. If you see Punjab and Malwa belt, all types of cancers are at higher rate, especially kidney, urinary bladder, breast cancer. And the important causes most probably are pollution, pesticides, which I always stress in my presentations, toxins in food. And if you consider Madhya Pradesh, oral cancers are highest probably because of tobacco and palm masala. We are observing a changing pattern in cancer incidence. It is seen that all stomach cancers, especially upper part of stomach cancers, are increasing. Lung cancer is going up, especially in the metros. Oral cancer is rising in men. Breast cancer is zooming in metros in younger females. We have seen many cases in young females at around 25 years of age who are suffering with advanced breast cancer. So there is an increasing trend of cancer in upper part of stomach, but there is a decreasing trend in lower part of stomach. And cervical cancer has gone down thanks to the awareness among public. Those who have reached menopause in increasing number are getting evaluated, maybe with pap smear, so that early cancer cases could be easily detected. So when we speak about our system, Ayurveda being the age-old health science with strong scientific therapeutic principles, and also with a great treasure of thousands of potent and safe herbal and herbo-mineral products, is expected to give an assuring answer to this excruciating problem. And always we must remember, when we talk about managing cancer, it's not curing cancer in each and every stage. If you can bring smile in face of dying cancer patients, that itself is the great contribution that you can do. So the excruciating experience of dying cancer patients can be definitely ameliorated by making use of our principles. Ayurveda can be helpful in different stages of cancer at different phases. Ayurveda may be useful in prevention, that is prophylactic. Ayurveda is useful for palliation. And in some cases, we could ensure cure also. But definitely, Ayurveda is useful as supportive. So in any stage of cancer, whether it is a virgin case or a terminal case, when patient approaches to you, you can lend your hand, you can do something to the patient so that patient will get at least some benefit, maybe in improving the quality of life or to improve the lifespan of the patient, which itself is a very good support. So when we speak about cancer, we cannot have a direct correlation with any of the conditions mentioned in Ayurveda. Cancer vis-a-vis arbuda may not be 100% correct, as all of you learned practitioners know this very well. There can be many conditions where cancer may be observed. So it may be diseases which can be clearly labeled as malignancy, or diseases which may be considered as malignancy, or there may be exceptions, or there are certain conditions where symptoms mimic malignancy, but 100% of the cases may not be malignancy. So accordingly, we have group 1, group 2, and group 3. In group 1, you may be having Mamsa Arbuda, Rakta Arbuda, Mukha Arbuda, Asadhya Vrana. In group 2, conditions like Mamsaja Voshta, Asadhya Galaganda, Tridoshaja Gulma, Asadhya Udara. And in group 3, you may be having Asadhya Kamala, which may be because of periampullary carcinoma, it may be because of cancer of head of pancreas, it can be because of hepatocellular carcinoma or some other condition also. Even Visarpa, even Asadhya Pradana, even Tridoshaja Nadivrana. Clinical presentations may be varying, cancer may be underlying cause. So this is the Mamsaja Voshta or verrucous cancer of lip, which is difficult to handle. recurrence rate is very high, or it may be alasa, adenocystic and mucoid epidermoid tumors of salivary glands, or it may be galaudha, carcinoma of oropharynx, or it may be mamsa kachapa, tumor of hard pellet. It may be asadhya galaganda, as we see in the case of papillary carcinoma of thyroid. This is the histopathological feature. Or it may be tridosha jagulma, intra-abdominal tumors, maybe primary or metastatic. Or it may be asadhya varana like this. It may be lingarsha or papillary carcinoma of penis. So my purpose here is to just make you aware and confirm that we cannot have a direct correlation of cancer with any single disease entity in Ayurveda. So accordingly, your general approach of treatment to cancer can vary a lot. Principles of treatment may vary in all these conditions. But however, there is a possibility of having certain standard protocol, standard methodology and approach. So that is how we developed our own line of treatment under the name of Mahaushadha. Now we will go to the next part of the presentation, where I will be speaking about a few of the Rasoushadis which we can effectively use in cancer management. All of us surely believe about the superiority of Rasoushadhi in clinical practice. We have been studying this since our second BAMS, Rasachikitsayam Shreshtatvam. Swalpahi matra vipula gunascha sadyohita deepana pachanancha और अल्पमात्रोपयोगित्वाद रुचे रप्रसंगतः क्षिप्रमारोग्य दायित्वाद औषधेभ्यो अधिको रसः असाध्येष्वपि दातव्यः रसोतः श्रेष्ठ उच्यते. All indicate that Rasoushadhi are superior because they are having a high potency, quick and higher bioavailability, long shelf life, small dose, and no problem with the palatability. And it is said that even when we consider that the situation is asadhya, we can make an attempt by giving Rasoushadhi. Some improvement in the quality of life or lifespan can be expected with Rasoushadhi. And there is a statement which all of you know, which is many times wrongly interpreted. That is, na doshanam, na roganam, na pumsancha parikshanam, na deshasya, na kalasya karyam rasachikitsite. So many people say that when you do rasachikitsa, you don't have to worry about dosha, roga, purusha, prakriti, desha, kala, etc. But that is not the fact. Whenever, wherever possible, you have to do dosha, dusha, vivechana. Prakriti, sattva, satmya, bala, agni, vivechana, definitely. Also desha, kala, vivechana. But there are many instances where we are not in a position to do this. A patient enters your clinic and he collapses in front of you. Maybe because of syncope. You check his blood pressure, it is not properly recordable. He is having 3D pulse. You don't have time to assess all these. You will have to treat him immediately. If you have any suspicion of the condition, give a Rasoushadhi. Say Hemagarbha Potali or Trinetra Rasa. Mix it with honey and Ardrak Rasa and give sublingually. So within minutes, patient will get up. His blood pressure comes up, and at least you have some time now to intervene. So this is the speciality and beauty of Rasoushadhi. It can be used in such situations. That is what this reference states. It's also said, Sarvashastrartha Tatvajno Najanati Rasam Yada Sarvam Tasya Upahasaya Dharmahino Yathabudha. You may be having adequate knowledge of multiple scientific disciplines, but you have no knowledge of rasa. In that situation, you will be definitely mocked at. That is what we will have to keep in our mind. But whenever we plan administering Rasoushadi, certain important factors which we should always keep in our mind. Rasaghatita Dhatvadi Shodhana Upadeshaha. Most important is the standard operative procedure adopted while preparing the medicine. Whatever the ADRs reported, whatever the incidences of toxicity are there, whatever the hue and cry are there against heavy metal toxicity or toxicity of Ayurvedic, herbal and herbo-mineral products, they are greatly attributed to the substandard medicine that we prepare. And of course, also because of using wrong type of medicine in wrong person, or improper dose or time of administration, improper anupana, and so on. And most important is samshodhya vidhina dhatun upadhatun vishanyapi yojayet karmani prajno dosha sanjayate anyatha. You have to carry out proper shodhana of metals, minerals, and toxic herbs that you use in a Rasa Shastra practice. Otherwise, definitely, it is going to cause lots of adverse effects. Our acharyas have documented them. They have clearly mentioned what happens if Ashodhita Dravya is used. What happens is if Asamyak Marita Dravya is used. What are the remedies in such situations? Adequate knowledge exists in our classics. So this is what we have to understand properly. And another important factor that you have to consider while administering Rasoushadi is Anupana. Rasasevane Anupana Prakara Nirdeshaha. There are two important factors which most of the Ayurvedic clinicians neglect grossly. They are time of administration or Aushadha Sevana Kala and Anupana. We simply say BDTID or we ask the patient to swallow with water. Anupana is not simply a carrier. It is not just a targeted drug delivery system. It is also a bioenhancer. And at the same time, it's also cytoprotective. We have seen in a study carried out on Rasamanikya that when chronic toxicity was studied, when Rasamanikya was given with water in animal study, it had shown some type of toxicity. There was uterine toxicity. There were small areas of necrosis in liver. But same Rasamanikya, when was given along with Madhu and Grita as per classics, no toxicity was observed. That means Anupana is important even for safety purpose. So it is rightly said, Anupanai rasa yojya deshakala anusarivihi. So according to the Aushadha, according to Desha, Kala, select right Anupana and give. If that is not possible for any reason, Doshagnaihi. You know that Stigdoshnai Marute Shastam. Pitte Madhura Shitalam. Kafenupanam Rukshoshnam. At least follow that. Next option is Madhuna, because Madhu is Yogavahi and Shrestha Anupana. And only if nothing is possible, last option is Jala. So you have to consider the importance of Anupana for optimum efficacy and safety of Rasoushadi. Now quickly we will have a look on the Rasoushadis that we can adopt in cancer management. For easy understanding, I have classified Rasoushadi into the categories like Khalviya Rasayana, Parapati Rasayana, Pottali Rasayana, and Kupivakva Rasayana. Chaturvidha Murchana or Chaturvidha Rasayana of Parada. And then we have Bhasma and Pishti, then Lauha and Mandura Kalpas. Under these titles, some quick examples I will give. It's not possible for me to describe each and all of them. So when we see under Khalviya Rasayana, I have considered Shiva Gutika. Shiva Gutika is a Samhitokta Dravya, as it contains good amount of Shilajatu. It definitely can be considered as a Rasoushadi. Shiva Gutika is found to be clinically very effective in multiple conditions, starting from immunosuppressive conditions like HIV positive individuals up to hepatocellular carcinoma, even including viral fevers. In our place of interest, in abdominal tumors, in cancer of urinary bladder, kidney cancer, CA pancreas and liver, Shivagutika can be used. I am also using Shivagutika, especially in urinary bladder cancer, renal cell carcinoma, and in some selected cases of hepatocellular carcinoma and cancer of head of pancreas. So currently, I have at least 3 patients who are on Shivagutika, and 2 of them are patients of cancer of urinary bladder. Then Vasanta Kusumakara Rasa. When we see Vasanta Kusumakara Rasa, always we think about Madhumeha, Prameha, or diabetes mellitus. It is primarily mentioned as a Vrishya Yoga and also Rasayana Yoga. It can be given in a dose of 125 milligram morning before food. In the case of Shivagutika, ideal dose is 1 karsha. Practically, it is difficult, but try to give 6 grams. If pill is quite large, let them powder it, mix with milk and take it. Pragbhakta or Apanakala is ideal for this. Vasanta Kusumakara Rasa is also useful as a chemopreventive. Patient is on chemotherapy and he is showing lots of adverse reactions, or he has completed chemotherapy and he is coming with many of the side effects. In such situation also Vasanta Kusumakara helps. It's a supportive drug in liver cancer, CA pancreas, and also in renal cell carcinoma. Karpura Rasa is of more academic interest than practical interest because unfortunately we are not able to prepare, market, and clinically use this product as it contains ahifena. Bhanga and ahifena are restricted for preparation of Ayurvedic medicines, which were already there in our pharmacopoeia for a long time. So luckily, now cannabis is being accepted and permission is being given to use Bhanga or cannabis. We are also using nowadays in our clinical practice, we have started using Bhanga products. Karpura Rasa is an ahifena product. Opium we are not allowed to use. However, in modern oncology, palliative care people, they regularly use opium derivatives like morphine, including patches, tablets, injections. So this Karpura Rasa is extremely useful in intractable diarrhea. When patient has got uncontrollable diarrhea, which may be seen in certain stages of colon cancer, or blood and mucus mixed stools, so you can give Karpura Rasa in a dose of 1 rati with Madhu or Mustakashaya in Apanakala or before food. We have Kanakasundara Rasa 2 rati in Takra or Dathi, in CA stomach or colon. Sarvanga Sundara Rasa 250 milligram with honey before food. In uterine cancer, when the presentation is similar to dysfunctional uterine bleeding. Madhumalini Vasanta, a very interesting formulation. It can be given in a dose of 1 rati or 125 milligram. The reference is from Rasachandamshu or Rasatantra Sarasiddha Prayoga Sangraha. It is used as a supportive drug in osteocarcinoma, like osteosarcoma, in lung cancer, as a chemopreventive, and also in leukemia. Chaturmukha Rasa, 1 rati with Madhu and Triphala Churna as chemopreventive in lung cancer, leukemia, and stomach cancer. Arogyavardhini, we are regularly using in liver cancer. In skin cancer, I have used this successfully in skin cancer along with other medication, leukemia, and also as a rasayana. Practical use 250 to 500 milligram. Classical use is Rajakola Falopama, if you remember. Another reference available is Kshudra Kola Falopama. Rajakola is around 6 grams. Kshudra Kola is around 3 grams. Practically, we are not able to use this standard dose. But if you are giving 125 to 50 milligram, it is a substandard dose. Maybe once a day at a right Aushadha Sevana Kala, try to give a higher dose of Arogyavardhini for best result. And when you use Arogyavardhini, remember 2 ingredients as most crucial. One is Katuki, which is highly restricted now because it is banned for trade. Its availability is reduced as it is a plant growing in sub-Himalayan range. Its quality has to be assured. Second is Tamrabasma. If Tamrabasma is not properly prepared, it can result in toxicity. So you have to ensure about these two ingredients, then use Arogyavardhini in multiple types of cancer. Gandhaka Rasayana is another such drug which we are using in a substandard dose, like 250 milligram. This is a classical Gandhaka Rasayana that I am mentioning. Shuddho Balir Gopa Yasa Trivaram Tataschatruljata Kuduchikadvihi Pathyaksha Dhatra Ushada Bringanire Bhagavaram Takartrakena. Siddhe Sitam Yoje Tulya Badam, that is important. Gandhaka Rasayana, it is called only when you prepare this with all these 88 bhavanas or 83 bhavanas and add equal amount of Sita, then only it becomes Gandhaka Rasayana. Its classical dose is 1 karsha, but at least give it in a dose of 3 grams, and it can be effectively used in certain conditions under oncology like skin cancer. Then we have Swarna Vasanta Malati, half to 1 rati with Pippali Churna and Madhu. In the conditions like leukemia and osteosarcoma, you can try. Panchavaktara Rasa in leukemia and lymphoma. Jayamangala Rasa, I have used this in leukemia, especially patient is presented with fever. You give Mrityunjaya Rasa, you give Sudarshana, Amrutarishta, but the fever is not subsiding. Jayamangala is one of the best drug of option. Give 125 milligram, powder it, mix it with madhu, 1 or 2 drops of Andrakaswarasa, and this will be giving definitely very good result. Then we have products like Gandamala Kandana Rasa, which is used in non-Hodgkin's lymphoma or papillary carcinoma of thyroid. Lakshmi Vilasa, especially Naradiya Lakshmi Vilasa Rasa, which is mentioned in Rajekshma, and also in Jwara Prakarana in Vaishajya Ratnavali. You can try this in lung cancer. Give with honey and ginger juice. Nityananda Rasa, I am using this in certain lymphoma conditions or wherever lymph nodes are involved in metastatic cases. So 1 to 2 rati, you can give it with Shitala Jala. And under next Parpati category, Panchamrita Parpati is my frequent prescription in colon cancer. By most of the prescriptions of colon cancer, it contains a Panchamrita Parpati, sometimes in gastric cancer also. Around 2 rati with honey and ghee. If you feel it is difficult for the patient to judge the dose or for you to make packets, you can use diluents like Jairaka Churna or Amalaki, and you can mix it properly and ask the patient to take in divided doses. Sarveshwara Parpati is found to be very effective in management of multiple types of cancer, especially oropharyngeal cancer and also in lung, colon cancer and leukemia. But practically it is very, very difficult to prepare this. All Maharasa, Sadhana Rasa, Uparasa, everything is included in this formulation. In market, it is not available. I know that dear Dr. Gopi Krishna is preparing this for his use. Probably you can procure from him and you can try this particular formulation. Rudra Parpati. So this is an interesting Parpati. It's the only Parpati where Kharapaka is required. So this is a Parpati which is to be given with Bhringaraja Rasa and honey in a dose of 2 rati. And in lung cancer, you can try this. Tridhatu Garbha Pottali in uterine, bladder and renal cancer. Abhragarbha Pottali as a supportive in lung cancer. I have used this. Hemagarbha Pottali half to 1 rati with ginger juice or betel leaf juice and drops of honey. So I have used this. Even currently, I have 2 patients who are on Hemagarbha Pottali. It has given symptomatic improvement in lung cancer. I don't say that it has helped in curing the condition. I don't have any such evidences with me. Even in colon cancer and leukemia, this can be tried. Lokanath Rasa, about half gram in liver and GIT diseases, but strict patya should be followed. Under Kopi Bhakwa Rasayana, we have Malla Sindura in lung cancer, Tamra Sindura in liver and lung cancer, Makaradhwaja and Siddha Makaradhwaja, which I am regularly using in lung cancer patients. Around 1 rati you can give. You can mix it with Sitopaladi Churna and Madhu and administer. It's a good chemo preventive also. Rasa Sindura, very good bio-enhancer. You mix it with herbal drugs, it improves the bioavailability of other herbal drugs also. Samira Pannaga, about half rati with honey and ginger juice. In skin and lung cancer, you can try Samira Pannaga also. Somarati Tamra Basma in lung and liver cancer. Hiraka Basma is so popular in northern part of India. Many people use Hiraka Basma in cancer. I did not get any such sufficient scientific evidence clinically to say that it is having such a remarkable result in cancer. However, we have a few in vitro study reports which say that Hiraka Basma is effective cytotoxic for certain cancer cells. Its dose is very low, 2.5 to 6.5 milligram, and it is mixed with Rasa Sindura, Makaradhwaja or Abraka Basma and given with honey as a sahapa. Especially in lymphoma and leukemia, this is found to be effective. It's a good chemopreventive also. Then Abraka Basma 1 to 3 rati in multiple types of cancer as a supportive drug, as a chemopreventive. In lung and leukemia cancer, blood cancer, you can try it. Swarnamasma, a very, very effective drug. It is a scientifically established drug in multiple types of cancer, especially in solid tumors. And it's very difficult for you practically administer Swarnamasma because of the cost factor. We know that 1/8 rati at least you have to give 15 to 30 milligram with honey or with specific anupana. In lung cancer, non-Hodgkin's lymphoma and in leukemia, and also as chemopreventive, you can try this. So Vanga Basma in stomach cancer, Vikranta Basma in uterine cancer, Manikya Basma in breast cervical cancer, osteosarcoma, colon cancer are some other options for us. There are two very interesting formulations and very efficacious formulations here, Raudra Rasa and Arbudara Rasa. Raudra Rasa, whether I have to call it Basma or whatever, here Kajjali is given multiple bhavanas and subjected to Puta. We have standardized this Laghu Puta for Raudra Rasa and we have found that Kapota Puta is most ideal. We evaluated Raudra Rasa against the human KB cells, which is responsible for oropharyngeal cancer, and it was found to be very effective. Clinically also, it is a validated formulation. In oropharyngeal carcinoma, you can try this. Arbudahara Rasa is another similar formulation, and it is being evaluated now currently. So many evidences are available regarding its efficacy. Both of these can be used with honey in a single dose, better morning in empty stomach. We have Lauha or Mandura Kalpa. Punarnava Mandura is very useful drug in both acute and chronic myeloid leukemia and hepatocellular carcinoma. It's ideally given with buttermilk, water, honey, or Falatrikadi Kashaya, especially in hepatocellular carcinoma. Its dose should be at least 1 gram. Another formulation which I am using is Dhatri Loha half to 1 gram with ghee and honey in equal quantity in leukemia, lymphoma, and multiple myeloma. A quick look on a few published scientific evidences before going into the second part of the presentation. For example, Swarna Basma. A study was carried out by Saumen Das and others. Here, this was a prospective clinical study published in Ayu in 2012 itself. He carried out clinical evaluation of Swarna Basma in 43 patients of solid malignancies. Different types of malignancies he had taken. The study period was 1 year. About 17 patients showed good response. Best result was observed in colon cancer, especially rectal cancer. about 7 out of 10 patients responded well. Nearly 41.02% had a survival rate of 1 year, but after 5 years, this got reduced to 15.38%. But a 5-year survival rate of 15.38% is also quite good. So this is the graph which shows the response of Swarnabhasma. Least response was seen in CA pancreas, which is otherwise also extremely difficult to treat by any system of medicine. Another study by Daniel and others is a popular publication. Some of you must have already gone through it. It is published in the most prestigious journal of the world, Nature Scientific Reports, where they have explained that Swarna Bhasma contains gold nanoparticles which enter the cells in the body. They established it. Its bioavailability is established. For this purpose, they had used 2 cancer cell lines. HeLa, that is human cells derived from cervical cancer. HFF1, that is human foreskin fibroblast cells. So they were selected. They compared laboratory synthesized gold nanoparticles and Swarnabhasma classically prepared. They characterized Swarnabhasma and found that it has got particles of varying size. It is not that all Bhasma, entire Bhasma is nanoparticles. It had crystallites of 60 nanometer size. It had crystallites of 471 microns also. And their observation was very interesting. Whether it is a nanoparticle or microparticle, both could enter the cell. They could enter even the vesicles, cystosols, and even the nucleus. And here, larger cells, they enter the cells via macropinocytosis and smaller cells via clathrin-dependent receptor-mediated endocytosis. So, being cancer cells, we can expect that Swarnabhasma can penetrate these cancer cells and may result in apoptosis. Studies were done on Lauha Bhasma and Tamra Bhasma also, and these Bhasmas were evaluated against human breast cancer cell line MDA MB231. This is an in vitro study, and both have shown moderate activity against human breast cancer cell. Another study was apoptosis, current chemotherapy status, and significant scientific evaluation of Tamra Bhasma in GIT cancer. So here, copper-induced apoptosis in PC12 cancer cells. They have observed that reactive oxygen species generation, regulation of apoptotic and anti-apoptotic markers could be done, like caspase 9, 7, P53, BAX, BAD protein, etc. They were activated, and BCL2, anti-apoptotic protein, was inhibited. By this, it is confirmed that Tamra Bhasma can induce apoptosis in cancer cells. Yashoda Bhasma was also studied against human pancreatic cancer cell line and found to be effective, and its efficacy was comparable with the standard chemotherapeutic drug adriamycin. Hiraka Bhasma, which was called as diamond nanoparticles, nano diamond based traditional Ayurveda formulation, it was evaluated against Dalton's lymphoma in vivo study in CD1 mice, and they found that Hiraka Bhasma mediated immunostimulation significantly, and it reduced tumor cell proliferation and induced apoptosis by active participation of dendritic cells. Entire mechanism is described here. I am not going for these details. Manikya Bhasma was found to be effective against multiple cancer cell line, like breast cancer cell line, cervical cancer cell line, leukemia cell line, where we could see that it had IC50 of 105 to 155 microgram per ml, which is a very small dose. Even in this small dose, Manikya Bhasma gave very good anti-cancer result. They could characterize the particles of nanocrystalline Manikya Bhasma up to a size of 70 nanometer. We have a very interesting article on Abraka Bhasma. This study speaks about effect of Puta on in vitro anti-cancer activity of Shataputi Abraka Bhasma on lung cancer cell line, leukemia cancer cell line, and prostate cancer cell line. What they established here was very interesting. So they took 3 different samples of Abraka Bhasma at various stages of Puta. Abraka Bhasma prepared by giving 20 Putas, 50 Putas, and 100 Putas were compared. And they found that as the number of Puta increased, their anti-cancerous efficacy was improved against lung cancer, leukemia, and prostate cancer cell line. And the best result was against prostate cancer cell line. 100 Puti Abraka Bhasma was most effective, and next 50 Puta, next 20 Puta. That is why, as Rasashastra says, more and more Puta are definitely useful in the case of Abraka Marana. Shilajatu is a very effective drug in cancer management, but biggest problem with Shilajatu is that it is highly adulterated. We are using tons of Shilajatu in clinical practice, but availability is less than that. One should confirm this, otherwise it may be a petroleum product mixed with benzoic acid for Gomutra Gandhi smell, which can be carcinogenic. So that is the reason why US FDA had banned Shilajatu, because of the fear that it can cause cancer. Otherwise, a good quality of Shilajatu is an excellent anti-cancerous substance, mainly because of the presence of fulvic acid, which is excellent antioxidant. And there are many studies on this Shilajatu also. It has induced apoptosis via the production of ROS, inhibited proliferation by inducing messenger RNA 22, inhibiting mRNA 21, HUH7 cells. So these are many studies on multiple types of cancers, especially on prostate cancer. I am still using Shilajatu products in clinical practice, not Shuddha Shilajatu directly. Even arsenicals. So we are using many arsenicals in our clinical practice. It may be Rasamanikya, it may be Haratala Bhasma, it may be Somala Bhasma, it may be Malla Sindura, it may be Samira Pannaga, it may be Tala Sindura, it may be Hinguliva Manikya. So in my practice, I am mostly limiting myself for the use of Rasamanikya, which is comparatively safer. And for a short duration, Malla Sindura is also utilized. So this is a study on herbometallic nanodrug Rasamanikya, and its anti-cancerous potential is proved. It acts on mitochondrial metabolism also. Arsenic trioxide in leukemia is established. In adult T-cell leukemia, it is found to be very effective. 15 cases of acute promyelocytic leukemia were successfully treated with AS203. It could inhibit leukemia and lymphoma cell proliferation by induction of cell apoptosis. In cervical cancer also, Somala was found to be effective. Realgar or Manashila nanoparticles were also found to be useful in cancer management, especially in mouse melanoma cancer. So malignant melanoma is one of the most difficult cancers to treat. Only surgical excision is the treatment possible. When there is metastasis, there is no treatment. And I had at least 6 patients. Unfortunately, I also could not get a required therapeutic benefit in these cases. I have not used Manashila preparations much. Use of Manashila itself is being restricted now as it is used in explosives. There is another Rasoushadi which you can try is Arkeshwara Rasa. Arkeshwara Rasa is evaluated scientifically, both clinically and also in vitro study. This formulation is found to be useful against pancreatic cancer cell, PACA2. So one of the drugs which you can try in the dreaded pancreatic cancer. There are 2 publications available on this. Raudrarasa I have already mentioned you. I'm not going for the details of the manufacturing process because of the paucity of time. And we studied this in laryngopharyngeal cancer along with Bhallataka Taila. Dr. Deep Singh Chawda saw that around 47% patients responded extremely well. There are many scientific works on Raudrarasa which are published here. Dr. Gautaman's work is in our institute. The first clinical study was by my senior Dr. Bhavana Bhoot, then my classmate Dr. Deep Singh, then Dr. Lokhandwala. He worked in a combination of Raudrarasa and Bhalataka. Then Dr. Ramesh Kumar from Bijapur. This was only in vitro study. Arbudahara is another formulation which I mentioned. Dr. Sridhar Gokhale, currently heading the Department of Rasoushadis at Yenagoya Ayurveda College, is working in his PhD on this formulation. He has already completed its animal studies and also in vitro studies. And as you can see, in oral squamous cell carcinoma cell, he could find extremely well IC50 concentration. Say at 25 microgram per ml, he could attain more than 50% of death of cancer cells, which is very good. We have one Siddha formulation, even though it is not from Rasashastra, as it is having very close relation with Rasashastra, and we are having very, very successful Siddha practitioners in the management of cancer. In Chennai and Thiruvananthapuram, we have a few practitioners who are using very potent Siddha preparations. One among them is Rasagandhi Melugu. Rasagandhi Melugu has to be given for a duration of 1 mandala. According to them, it is 41 days. Dose is 180 milligram BD to be given with buttermilk. Method is 8 days continuously you have to give twice a day. You should not take any bath, or ask the patient not to take bath during the Aushadha Sevana Kala. After 8 days, stop the medicine, ask the patient for bath, then again continue. So like this, you have to do for 41 days in the same order. Takra, Odana, Kshira or Patya, Vidahi Ahara, Kshara Padartha, Ativyayama, and Mamsahara Apatya. This is a very strong drug, but it is found to be very potent suppressor of cancer cells. A publication is already available on this particular formulation. In HPV positive cervical cancer cell, it was found to be extremely useful formulation. So now let me enter into the second part of my presentation. And this is about our clinical experience on an Indian answer to universal ailment. The name of this approach is Mahaushadha Kalpa. This name is patented. This line of treatment is also patented. Under this category, we are having 2 US patents for our products, that is Munex type 1, type 2. 1 US patent for the entire therapeutic approach, and 1 US patent for Hiranyaprash, one of the nano gold emulsion that we are using as a part of Mahaushadha Kalpa. So what are the integral part of this approach? It's a multidimensional treatment inspired by Bhagavan Buddha's teaching. No adverse effects, induces a sense of well-being. Here we are having at least 8 components. Munex tablet will be an integral component, whichever is the type of cancer with which patient is suffering from. Second is Hiranyaprash. Majority of the patients are given with Hiranyaprash. Third is Mahaushadha granules. Fourth is a line of treatment mainly Panchakarma based Ojo Kalpa. Fifth is a dietary advice. Sixth is a lifestyle management. Seventh is dhyana, especially anapanasati, whenever possible, or vipassana. And eighth is a unique pyramid therapy. So this entire combination is utilized in managing cancer. Couple of sentences on each of these. First is about our basic drug Munex tablet. So this is a licensed polyharbomineral formulations with US patent. Its safety study is established as per OECD 423 guidelines. It has antioxidant, anti-tumor, anti-inflammatory, anxiolytic, immunomodulatory ingredients. We have carried out in vitro study on multiple 12 cancer cell lines. We studied even genetic study, gene expression, DNA fragmentation and apoptosis activity by cell cycle analysis against A549, that is human lung carcinoma cell lines we studied, because we found that best result was against lung cancer. It increased the level of P53BCL2. It upregulated all three gene expressions. It was effective against human lung carcinoma, human cervical adenocarcinoma, human ovarian cancer, pancreatic cancer, human hepatoma adenocarcinoma, even gastric cancer, U937 lymphoma carcinoma, and EB3 or Burkitt lymphoma. These are all the cell lines where we could find moderate cytotoxic activity of this particular drug. In vivo, we established that it is having anti-cancer activity in Dalton ascitic lymphoma, which is comparable with the standard 5-fluorouracil. Next, about other medicines. According to the type of cancer, according to the Srotas involvement, according to the Doshik involvement, according to the clinical presentation, other research products of our institute and all those classical medicines which we already discussed now, they are added as per the requirement. Hiranyaprash is found to improve immunity. It is established to have an immunostimulant activity, and it is found to be very effective in treating leukemia. It's used as a supportive therapy in all types of cancer. Mahaushadha granules, which are having a natural antioxidant herbs, including cilantro, garlic, jaggery like drugs, is used mainly in those patients who are already under chemotherapy. This is having very good chelating action on heavy metals and on chemicals. It minimizes the adverse effect of chemotherapy. And another important factor is diet is not under our control many a times. We are engulfing toxins every day. So Mahaushadha granules will help to minimize these food toxins also. Ojokalpa, where we are judicially combining Panchakarma, especially Basti, wherever possible, is found to be very effective. Then Takradara, Tailadara also we use. Dietary advice, I can't go for those details, but I must clearly mention you that diet is a very, very important factor in cancer initiation and in cancer progress. We are seeing many young individuals coming to us as victims of cancer who have no bad habit, no smoking, no alcohol. They are maintaining a good lifestyle, but main problem is with the diet. And especially the fruits and vegetables which are bombarded with the pesticides, which are genotoxic. So you have to be very, very careful regarding the diet. Of course, vegetables, fruits, they contain vitamin C, E, carotenoids, which are good antioxidant, anti-cancers. There are many studies on this. Next is a dhyana. There are certain publications available where a simple meditation could help the patient to come out of the disease. Evidences are there. This is a link on the effect of Vipassana meditation on cancer. A few evidences have been shared here. Due to paucity of time, I cannot explain them. Samatha dhyana or Maitri dhyana or pranayama, definitely you use them. It will at least help the patient to come out of fear. We are using another very unique type of treatment here, that is a pyramid therapy. Pyramid is a special type of structure constructed with unique angle, and it is placed perpendicular to north-south angle, and patient is asked to sit inside and meditate. He can simply concentrate on his breathing, which is the easiest one. And we have seen that there are a couple of studies carried out on pyramid therapy from the modern allopathy discipline. One is from the Department of Biochemistry, another is from the Department of Physiology. They have been published, and they have proved that this is having excellent antioxidant, free radical scavenging property, anti-stress effect also. And we are using this as an integral part of our cancer treatment, which will help the patient to recover quickly. And it is also very useful in all those patients who are suffering with the adverse reactions of chemotherapy and radiation. Now, quickly, some clinical data in a few minutes, and then I will conclude. So, Mahaushadha Kalpa, as I said, we have started in 2005 and 6. So, till now, probably around 1,100 plus cases of cancer we have treated under this, various types of cancer. And when this data I prepared, it was about 738 patients. Now it is 1,100 plus patients. Out of these patients, as per the data, 80 different types of cancers we recorded. And we had seen cancer of various stages. A few which we detected in our clinic, few virgin cases, stage 1 cases, and many terminal cases, many patients who have not taken any conventional treatment, some patients who were operated but not taken chemotherapy or radiation, some patients who have discontinued chemotherapy in between, some patients who were taking concurrently chemotherapy and radiation. So various kinds of cancer patients we had seen, and this is the graph of that. And you can see maximum number of patients were of lung cancer, and C of oral cavity, and here C of stomach, and good number of breast cancer also. So these are all the statistical data which I would like to skip. But one point I would like to highlight: 62.2% of lung cancer patients that we treated had metastasis. So this was the symptomatic improvement that we could see. 60% patients showed symptomatic improvement. 4% became totally asymptomatic. And 5%, the 5-year survival rate, 5-year survival rate and disease-free survival rate in lung cancer, especially with the distal metastasis, was 31.25% in our treatment, which is far higher than the conventional cancer treatment. And in conventional cancer treatment, it is just 5% as per Cancer Facts and Figures 2019. So we had, out of 74 lung cancer patients, 31.25% 5-year survival rate in distant lung metastasis. Just a couple of examples here. Now, this is a case of a 63-year-old lady, metastatic breast cancer. She was operated for breast cancer. Radical mastectomy was done. She had undergone chemotherapy. But unfortunately, cancer recurred with lung metastasis and pleural effusion. She came in March 2022 with the complaints of loss of appetite, bitterness in mouth, general debility, pain in flanks, exertional dyspnea. She was a case of diabetes mellitus and hypertension. We advised her yoga, pyramid therapy, diet advice, gave her Munex 2-tablet VD, Hiranyaprash 4 drops in morning in an empty stomach, Kanchanara Gugulu 1 tablet VD. Then I made a combination of Lagusutha Mishrana 10 grams, Ashwagandha Churna 20 grams, Pravala Basma 2 grams. So this mixture we gave around 3 grams or about half teaspoon twice a day with water. On 9th April, it was first follow-up with reduced cough, pedal edema got reduced, other symptoms persisted. Her CA 15.3 level was within normal limits. So we replaced Kanchanara Duggulu with Punarnava Mandura. We added Sitopaladi Churna to the mixture. We added Madhifala Rasayana and continued the treatment. Her cough and dyspnea got reduced, nausea reduced, general debility got reduced. We changed Madhifala by Muniliu. Then we changed Churna combination where I incorporated Swarna Malini Vasanta. And after 2 months of treatment, her appetite improved. Pain in flank and shoulder was there to some extent. We continued the medicine. Next month, cough got reduced. Wheezing was absent, but there was a constipation. We gave Munipile Leha, which is similar to the Manibhadra Gura and Dhanvantra Gurika. And we continued this type of treatment with the periodic changes. So in 2023, after about 1.5 years, so we came out with something known as a Mahaushadha kit, which is a combination of Munex tablet, Hiranyaprash, Mahaushadha granules. We made some changes in our combination and we continued the treatment. And we could get a very good clinical improvement. And you can see this is the scanning report and history. You can see here PT2, N2, M0. This is FNAC confirmation of the diagnosis. And here, bilateral the kidneys showed some increased cortical echogenicity. Moderate pleural effusion was there, and this stage was when the patient came to us. And when we carried out HRCT after our treatment, we could see irregular pleural thickening along left lower lobe. Pleural effusion disappeared, and there were no lesions in the lungs except for diffuse interstitial thickening. This patient came last week also for follow-up. This is after 2.5 years, and she is having no cough, no dyspnea. Her X-ray showed no pleural effusion, and she is continuing our treatment. So this is very highly encouraging result for us. One more case of lung cancer is a 68-year-old Muslim with IDDM and IHD. And this was our first successful treatment of lung cancer, which gave us a lot of boost, and we could continue up to this level. And he continued treatment for 11 years. The history of breathlessness, 2 years history, pleural effusion, pneumonia, adenocarcinoma was confirmed. No conventional treatment was taken. He had undergone cardiac bypass also. So he was given with Munex, Munistamine, a combination of Makaradhvaja, Ashwagandha, Yashti, Laguskuta Mishrana, pyramid therapy, pranayama, and a diet advice. These were the initial medication. Then time to time, we made changes in every follow-up, depending upon the changes in his clinical presentation. He had hemoptysis, for which we added Navaya Salauha, Godanti Basma, and Chandrakala Rasa later. His hemoptysis got reduced in next visit. Pyramid therapy we continued. And the treatment continued for about 10 months. And then we took CT thorax. No cancer lesions were seen within 1 year. Only emphysematous changes and fibrosis were there. At this stage, our prescription was Munex 2-TID, Munistamine tablet 2-BD, our proprietary product, insulin 2-BD for diabetes, a combination of Lagasuta Mishrana, Ashwagandha, Yashti, Godanti Basma, Navaya Salavaha, Makaradhwaja, half teaspoon BD with water, and Chandrakala Rasa 1 ml. And as the time passed, we gradually reduced the medicines. After 1 year, chest X-ray showed no cancer lesions. One lymph node calcification was there over right scapula. So we maintained with Munex 1-TID, insulin 2-BD, and Triphala Churna and Godanti Basma. This was the only treatment that we gave him. And this was continued. This is a bronchogenic carcinoma, and you can see after treatment, no lesions. Then there is a case of cancer of uterus, 57-year-old lady. She had undergone pan-hysterectomy. She undergone partial chemotherapy because of non-compliance. She could not complete. Unfortunately, she developed her cancer again with intra-abdominal metastasis. She had ascites, and we could treat her very successfully. Her ascites got completely relieved. CA-120 level is normal. For last 12 years, she is under regular follow-up. She is from Pune. She referred many patients after that. Even today, she is under follow-up. So Munex, Kanchanara Gugulu, Muniliu plus Kamaduga were our initial medication, along with the Punarnavashtaka Kashaya Shatavari Rasayana, a combination of Amalaki Churna, Yashti, Guduchi Sattva, and Godantinis. And now she is only on 1 BD of Munex and also Muniliu plus 1 BD. No other medicines she is taking currently. So these are how the cancer markers showed the improvement. So one more case of CA cervix we treated. Her CA 150-25 level is normal. She came to us with the complaint of discharge per vagina, which was blood tinged, and pain in lower abdomen. She approached us in 2012. Now this is 12 years. Now she is disease free and under regular follow-up. You can see in this picture, it is diagnosed as a small cell carcinoma of cervix. And here you can see known case of carcinoma of cervix. Present scan shows bulky cervix, no hepatic focal lesion, no lymphadenopathy or ascites. Here again you can see the follow-up scan. Minimal cervical wall irregularity with calcification, no hepatic focal lesion, ascites or lymphadenopathy. Again we repeated this after 1 year. No obvious mass lesion, no other significant abnormality. So she is being subjected to scan every year, USG and also CT abdomen pelvis with contrast. Next is a couple of cases of non-Hodgkin's lymphoma. A 28-year-old male, a high-grade large cell type of non-Hodgkin's lymphoma came to us in 2006. After treatment, he became asymptomatic. His CT scan, USG abdomen biopsy remained normal. LFT, RFT, LDH are normal. So this is the diagnosis. This is the histopathological report, which has confirmed non-Hodgkin's lymphoma. And now you can see, after treatment, histopathology says that it is only reactive lymphadenitis, no cancer lesions. Now he is asymptomatic. Now his latest prescription, he came last month also. This data is of 2023. His latest prescription is still the same, Munex 1-BD and Muniliu plus 1-BD. And recently we checked his LDH level, which was within normal limits. Because in between, about 6 months back, we saw that his LDH level was slightly raised. So we did not want to stop the medication. The reason may be different. We are still continuing. Patient is feeling happy to continue this. Then about leukemia, a 21-year-old boy of chronic myeloid leukemia is being treated since 2012. And he came to us with the complaints of low back pain, pain in thighs, intermittent fever, and pain abdomen. He took Gleevec, imatinib mesylate, the oral chemotherapy drug, for some time, and then he stopped them. And an important marker, RT-PCR gel electrophoresis, showed that his BCR-ABL is not detected. That is very interesting. We gave him Munex, Panchatikta Gulu, and also Punarnava Mandura. So this is the 2016 repeated report. Is LFT, LDH. One more case of chronic myeloid leukemia. This patient also is a similar patient, 29-year-old male. He was on Gleevec. And now, after starting the treatment, he is married, he is having children, and he is disease-free now. But still, he is continuing the treatment. Initially, we gave him Jayamangala Rasa as he had intractable fever, along with Punarnava Mandura, Munex, Kanchanara Dukulu. And this is how his clinical improvement is observed. I'm sorry, it's not possible for me to explain this. If you want, I will share this entire presentation to your group. You can go through for further details. Currently, he is on Rasoushadis Gulu and Munex because he is having L4, L5 disc protrusion. So this is his latest BCR-ABL aberration test, which is showing that SA is 0.001%. It's almost cured. After 3 years of treatment, you can see that BCR-ABL gene expression is not detected. So another oral cancer cell patient is there from Sirsi, 78-year-old male patient. So he had undergone surgery. His case was T3N2A. Then he had undergone partial chemotherapy. He had undergone radiation. Then he came to us with a large lesion on his face. His cheek was almost open completely, and he was treated in our hospital. The stage-wise improvement is documented in this presentation. According to every follow-up, the details are here. So this patient was completely cured. As you can see in PET CT scan report, after treatment is CT scan. So mild fat stranding in region of left buccal mucosa, fibrotic changes, no other abnormalities. Unfortunately, this patient is no more. So 2 years ago, he died of cardiac arrest, unrelated to cancer anyway. Then finally, just 1 or 2 cases. This is a patient of multiple myeloma. A female patient, 44-year-old, her bone marrow cytology confirmed plasma cell myeloma. Her clinical history was backache. She came in 2019. She had undergone 16 chemotherapy, palliative radiation of 30 gyres in 10 fractions, because she had a skeletal metastasis from T8 to T10, T12 to L4. Radiation was given. Despite conventional treatment, pain remained unchanged. Kappa lambda ratio remained high. She took the treatment for 15 days, Munex, Navajivana Rasa, Panchatikta Glu, which is a good drug for bone marrow. So she showed improvement in back pain. Patient was suggested for bone marrow transplant. She went for that. She discontinued the treatment. She was under remission with normal kappa lambda ratio, and she was almost asymptomatic or reduced symptoms. But after 2 years, she gradually developed the symptoms. There was general debility, nausea, increased back pain, pain all over the body, paresthesia in lower limbs. And on evaluation, her disease recurred. She was started with xylendronic acid and lenalidomide, and she took 12 cycles with no improvement. Disease remained resistant, and then she came to us. On 29 March 2023, her kappa lambda ratio was 31.99 because maximum is 1.65%. You can see that it is a high range. So we started with the Mahaushadha kit, Gugulu Tiktaka, Punarnava Mandura, and after 4 months of treatment, kappa lambda ratio came down to 6. Now, patient had symptoms of Amala Pitta, pain got reduced. We gave Kamaduka with Mautika. Then after 1 month, kappa lambda became normal, 0.63. Currently, she is comfortable, no back pain, no abdominal discomfort. For last 6 months, she is under regular follow-up. Since September 2023, her prescription is the same. Munex 2BD, Hiranyaprash 4 drops morning in empty stomach, half teaspoon BD of Mahaushadha granules, Gugulu Tiktaka tablet 1 BD. These are her reports, bone marrow biopsy report. Here you can see reduced IgG level and kappa lambda ratio. And kappa lambda ratio which came down to 6. IgG is increased. This is a normal kappa lambda ratio. So these are a few examples. There are many such cases. For an individual case, it may require an hour of deliberation. Sorry, I could not meet all those things in this time frame. So before concluding, a couple of slides. Factors to be considered while using Rasevaga in clinical practice. First, quality assurance. Second, right dose. Third, right time of administration. Fourth, proper anupana. Fifth, right pathya for disease, for aushadha also. And confirm the proper shelf life. Risk related with Rasoushadi can be considerably reduced if you follow good collection practices, good manufacturing practices, good laboratory practices, and good clinical practices. So Ayurveda has a lot to offer in cancer management. Rasoushadis have an upper hand. We have to follow a scientific, holistic approach. Never feel lack of confidence because you can definitely contribute substantially. Even though modern oncology has drawbacks, this is important, you must remember. There are lots of adverse effects with the chemotherapy. Person who is expected to live for 1 year dies in 2-3 months because of chemotherapy, because of severe bone marrow suppression. But still, there are lots of advantages from modern oncology treatment also. Say acute myeloid leukemia, we can't do anything. They can definitely manage it substantially. If it is an operable case, as in the case of CA breast, always you should recommend the patient to go and get the surgery done. So there are many strong areas where modern oncology can offer. You should not tell the patient that you don't go for that, you come to me, I am going to cure this. So that is unethical. You assure the patients, but never give false assurance. Never go for tall claims. You must understand the basics of modern oncology also before giving your drug. Because in India, we have seen in many places, modern oncologists are totally closed to Ayurveda. And it is very sensitive. And if patient is having a natural course of cancer at a terminal stage where he is going to succumb, if he approaches Ayurveda doctor and at a fag end, if he goes back to an oncologist, all the curse they have to hear. So we must understand this, but at the same time, keep all your confidence. Don't have any tall claim, any type of cancer, any stage. We can do something to the patient. We can bring a smile in dying patient also. Thank you for your patient listening. And there is a statement here by Bruce Lictor. He says that very important is we are not the victims of our genes. We are masters of our genetics. We have something known as epigenetics. You can modify your genes and advise your patients to have a positive thinking always. Sarve Santu Niramaya.
Thank you, sir. Really, it's excellent research-based presentation, sir. Thank you once again for wonderful presentation. It's rare to hear the cure word. Actually, we have seen in your case presentations, you have cured so many cases also. Thank you. Thank you once again. Shall I take some questions, sir?
Yes, please.
I request delegates to raise their hand and unmute, and they can ask the question directly, or else you can post in the chat box. Dr. Basaraj? You can unmute and you can ask the question.
Doctor, please go ahead.
Dr. Nitin? Yeah, Dr. Harish, you can go ahead.
Yes, ma'am. Good evening, sir. Myself, Dr. Harish here. Sir, I just want to know that all the Rasoushadis which we are using, it is going to act at the only cellular level, or it is going to act at dosha dhatu levels? It is the first question. And the second one is whether if it is acting at the nuclear level, are we going to record this after giving the medicine, or we know prior to ingestion itself, or we know whether it is going to act at the targeting cells? Like already, are we aware that it is going to act at this level only, or we are recording the route of the drug after giving?
Thank you, doctor, for your question. So I have just given you an evidence to say that it acts at cellular level. It doesn't mean that it acts only at cellular level. It also acts at cellular level. That is the idea behind this.
Okay.
Just like any Aushadhi, this has got multiple targets of action. So when we select any Aushadhi, it may be a Rasoushadhi, it may be a Kashnaushadhi, or it may be a combination of this. We are not treating the patients only with the Rasoushadhi. We are using multiple formulations in treating the cancer patients. Just like any other Panchabhautika Dravya, Rasoushadhi also has got multiple targets to act. At dosha level, at dusha level, at srotas level, at bhutagni level also, it is possible for us to assess this. If you see later texts, only old texts like say Rasarnavam Nama Rasatantram or Rasarudaya Tantram, where Dhatuvada Dehavada are highlighted, you may not find those properties of Rasaushadhi which we speak nowadays. But all later texts where Chikitsa part of Rasaushadhi came into existence, we do find Rasapanchaka described for Rasaushadhis. Their Rasa is mentioned, their Vipaka is mentioned, their Doshagnata is mentioned. So naturally, these Rasaushadhis have their action at Srotas and Dhatu levels also. Beauty with Rasaushadhi is that most of them are having Yogavahi, Sukshma, Vyavahi, and Vikasi type of actions. So they can have excellent bioavailability. They themselves get absorbed and reach plasma very quickly. At the same time, they also help other herbal ingredients with which they are administered to enter into the bloodstream very quickly. To quote an example, Kajjali enhances bioavailability of even allopathic drug like rifampicin. So that means the Rasaushadhi used here is helpful for the absorption and assimilation of other herbal drugs also. So you can expect the targeted organ at dhatu level also. Then second point is action at the nuclear level. So this was established in the case of Swarna Bhasma. We could see in Manikya Bhasma, Hiraka Bhasma, Abraka Bhasma. In few of the Bhasmas, it could be scientifically established, where we could see that the nanoparticles, even microparticles, can pass through the cell membrane. You asked me whether this can be predicted. We can have some ideas. So based on the published literature and based on our expected targeted action and the vehicle or anupana that we use, we can have some prediction that this drug will act on a particular type of tissue. So when we see a patient suffering with cancer, he may be having a primary cancer in liver, he may be having a metastatic cancer in liver. In both these cases, the cells are different. Patient may be having stomach cancer with hepatic metastasis, or he may be having hepatocellular carcinoma. In both of these cases, lesion is in the liver, but our approach may not be the same. So for this, it is better to have an idea about the possible cells that are susceptible to the product that we are using. It is not 100% foolproof. A few evidences we have, and some ideas we can develop based on our clinical experience. And this needs more and more research work. I hope I have partially answered your question. And my direct idea is to say that there are multiple targets where the Rasoushadis can act.
Okay, sir. Thank you, sir.
Next question, Dr. Nitin. Dr. Nitin.
Hello, sir. Hello,
Yes,
sir.
yes, doctor, I can hear you.
Sir, which Rasoushadis is used in chronic pancreatitis, sir? Which?
Chronic
Hello, sir.
pancreatitis.
Yes, sir. Yes, sir.
Oh, however, this is the it is not related to today's topic, but we have been treating chronic pancreatitis. That is why I think I can answer this question. So currently, so in my practice, I am using 3 formulations successfully. I have 4 patients now who are taking medicines, who are under very good remission. And among them, 2 are males, 2 female patients, age varying from 25 years to 40 years, with elevated serum lipase and amylase level, which have gone down. In one patient, it is still high. In all others, it has gone down to normal. The 3 drugs which I incorporate in multiple drug prescription are: 1, Shiva Gutika. I advise this 6 gram before lunch, Prag Bhakta, not Abhakta, in Apanakala, before lunch. And here I am not using any specific anupanas except for diluted milk or Ushna Jala. You can also try Vasa Gudu Ichchadi Kashaya, but it becomes difficult for the patient to consume. So usually I ask the patient to powder it, mix with the diluted milk and consume, or with water. Then the second drug that I use extensively here is Godanti Bhasma. Godanti Bhasma you can use as a single drug also at a higher dose of say around 1 gram. Or you can use Godanti Bhasma in combination of Amalaki Churna. I usually use a combination of 1 part of Godanti Bhasma, 10 parts of Amalaki Churna, and again 10 parts of Yashti Madhu Churna. So this combination we make, we give it in a dose of about 3 grams twice daily with Shitala Jala. And the third drug which I use is an Narikela lavana. This is the most efficacious drug in treating chronic pancreatitis and also in cholelithiasis. In my clinical practice, this is the only drug with which I got the result in treating gallstones. Because Rasatarangini clearly mentions Nisara Yavajopetaha Pitta Shoshaja Shulanut. You have to give this in the condition of chronic pancreatitis where there is a possibility of a calcification. So in chronic pancreatitis with the calcification, whether there is a cholelithiasis, cholecystitis or not, you can incorporate Narikela lavana. Mix Narikela lavana with Lavasagara and Yavakshara in equal quantity, and you can directly administer it in a dose of about 1.5 gram. Or you can add about 10 times of Amalaki Churna in that and blend them properly. You can give it in a dose of 3 grams PD. This is also Pragbhakkatala with Ushnodaka. And apart from this, depending upon the presentation, we give Muniliu plus our proprietary drug. So you can also use Arogyavardhini in some patients. Patola Katurovanya Kashaya is also very useful. And these combinations we are trying apart from the Rasoushadis I use in my clinical practice.
Thank you, sir. Thank you, sir.
Thank you, sir. Similar question Jay Sahu was asking. For chronic pancreatitis, what to do? Same thing only, I think. Right, sir?
Okay.
Where can we procure Rasoushadis? How can we refer patients to you? This is from
There are
Dr.
two parts of the question here. So
Yes.
procuring Rasoushadi, I always suggest, if possible, try to prepare them domestically. Because the beauty with Rasoushadi is that if you prepare a small amount, suppose you prepare 100 gram, you can practice for 3 years to 5 years. So you try for that whenever possible. I must appreciate dear Dr. Gopikrishna, who has dedicated himself in preparing Rasoushadis, and he domestically prepares it. He doesn't have any industry. So like that, I know a few practitioners who are preparing certain Aushadis. You can have at least Kajjali based preparations. You don't have to go for Abrakabasma, which may be difficult for you to prepare, or Lohabasma, which may be difficult for you to prepare. There are many such Rasoushadis, especially Vishadravya containing Rasoushadis. We have one more Dr. Krishna Prakash, who is using only Vishadravya containing Rasoushadis. He prepares domestically and uses so that you can confident of whatever the drug you use. That is first advice. Second, there are some companies, better not to name them, but if at all you insist me, 1 or 2 companies, say Dutta Papeshwar Limited. Some companies, I don't say that all medicines are par excellent, but there are some medicines, Rasoushadis, which are of good standard. You should know how to test them, especially if you are preparing Basma, you should establish the standard of the Basma. So then you can utilize them. There are huge number of Rasoushadis. You don't have to use all of them. You use certain selected Rasoushadis. Hopefully, in further discussions, to some extent, I may help in this. Then second is referring to me. You can refer to me. You can call me. You can send an email, whatever. So patients do come from different parts of the state and country to us. So it's not a problem. So we can help the patient as much as possible. So whatever which can be done within our limitations. Thank you.
Thank you, sir. Sir, which company this Narikela Lavana is best, sir?
This is a problem actually. We do not have a sustained supply of Narikela Lavana as per my knowledge.
Yes, sir. Yes, sir. We didn't get that's what.
Yeah, SDM College of Ayurveda Pharmacy, they were preparing this intermittently. So maybe once in 6 months or so. But that product was not having the kernel in that. If you remember the reference, it is clearly mentioned that Lavanaha Kajjala Rupaha Kapalam Shojitam Haret. It should be Kajjala Rupaha. You should include the burnt kernel, that black color should come. That was not there. So what we do is we use our own product. So Narikela Lavana, we prepare in our pharmacy and our PG scholars also under our supervision. It's very easy to prepare. You prepare it and use it. Satoya or Atoya method. If you want more output, you can use Atoya method, Rasatarangadi reference. If you are following Vaishajya Ratnavali reference with water, the output is comparatively less. If you want specifically to try in Parinamashula like a condition, then go for Satoya method. Otherwise, you can follow Rasatarangini reference. If you are preparing Narikela Lavana for gallstones or pancreatitis, in all these cases, you can follow Rasatarangini reference. You prepare it. Anybody can prepare it easily at their home. So in one Narikela, you may get 100 to 120 grams. So that is quite a good amount. You can prepare it once or twice a month. Because storage is also difficult for this, you can use it. It's not too difficult.
Sorry, I was muted, sir. Sorry.
Yeah, no.
One more question from Dr. Harish. Sir, is there any management for chronic glaucomatous lesion on face, or you came across in your practice? Now same patient is finally diagnosed as Melkerson-Rosenthal syndrome.
Okay. So I have not treated many cases. Only one case I remember of treating this condition. The patient is not under follow-up, so I cannot assure about the result. But initial observation, I can tell you, we managed the patient for about 1.5 months. I don't know what happened after that. Here, the drug which we concentrated was Rasamanikya. We can make a combination of Rasamanikya with Triphala Churna. We usually make a combination of 1 gram Rasamanikya in 50 grams of Triphala Churna. Depending upon the prakriti of individual, suppose you feel that patient is having more Pittaja Lakshanas, so you can incorporate Uduchi Sattva or Godanti Basma. Otherwise, only Triphala Churna and Rasamanikya. So this mixture you have to prepare. First, take Rasamanikya in a kalva, powder it. Go on adding Triphala Churna in small quantities and dilute it. This was given in a dose of about 3 gram once a day with Madhu and Grita, mixed with Madhu and Grita, liquid, followed by drinking of Patola Katurohinyadi Kashaya, which is a very good Rakta Shodhaka Dravya. It is a Tvacha Dravya, it is a Varnya Dravya, it is a hepatoprotective also. So this was our key approach. Along with that, we tried a high dose of Gandhaka Rasayana in the patient also. Initial improvement we could observe, but I cannot give you the entire detail of the patient as the patient was not under follow-up further. This is only a very basic minimum clinical experience I can share. Hopefully you can also try with this with other possible combinations.
Okay, sir. Thank you. Thank you so much. Now, I think no more questions. Dr. Lakshmi, someone has raised hand. Dr. Lakshmi.
Hello. Yes. Namaste, sir. You were mentioning about Patola Katkaronyadi Kashaya.
Yes.
It should contain Chandana in it. Do you prepare it by yourself or do you get it from other pharmacies?
We prepare it in our institute. So we have Patola Katurohinyadi Kashaya. We also have Patola Katurohinyadi Kashayam tablet. So both we prepare in our pharmacy. In market, it is available, as you know. We are preparing ourselves.
Because whatever is available in the market, instead of Chandana, they are using
Rakta
this
Chandana.
Moringa.
Yes.
Even ideno Nuggekai, Moringa, they are
Shigru.
using
Shigrutva.
Shigro.
Yes.
But that is not mentioned in the classics.
Not mentioned in the formula. It is, I think, some traditional practice in Kerala that they are using. At least Rakta Chandana you can use as per the general guidelines. The Sastra Yogam says that you have to use Shweta Chandana. But as per the Sharangadhara's guideline, Kashaya Lepayo Prayo Yujate Rakta Chandanam, at least Rakta Chandana you can use and prepare it. If you are replacing it with Shigru, its property will be completely changed.
Yeah. So now you are using pure Chandana, is it?
Yes, yes, we are using Chandana.
Okay. So it is your own preparation. Okay.
Yes.
Thank you.
Thank you, sir. Now I request Dr. Amulya to say a vote of thanks. Dr. Amulya.
Yes, ma'am. Hari Om Tanvantri. A very good evening to one and all here. So indeed, it was a great knowledge enhancing session. Thank you so much, sir. I would, on behalf of Team Ross, I would like to extend my heartfelt gratitude to our eminent speaker for today, Dr. Satyan Bhatt, sir, for a wonderful presentation on application of multidimensional Ayurvedic treatment in management of cancer as per his clinical experience. So, sir gave a wonderful explanation on application of Rasoushadis like Parpati Kalpana, Kupi Pakwa, and other medicines in detail. The speciality was that even in his presentation, it was research-based presentation. So, which was very unique and more, it would build the confidence in the Ayurvedic practitioners, so that we can proudly say, yes, we do have have an effective treatment for cancer because of all these researches. So because that's what the many other system would ask for us. And he also reminded us that definitely the Rasoushadi is one of the blessing for the mankind. And he also introduced us with an unique Ayurvedic therapy in cancer, that is Mahaushadha Kalpa, which was very new for us. And we are very glad that these unique medicines like Munix and Mahaushadhi Kalpa and Hiranya Prasha, these are all US patent medicines as well. So, and the conclusion he gave in the end and the quote he mentioned in the end was cherry on the cake. So thank you so much, sir. Once again, I know in your busy schedule, you took out some time and gave us so much information. And definitely, you already told this is just one part of your, cancer management thing. We are looking forward for many more sessions with you, wherein you can give many more applications or many more therapies, Ayurvedic therapies for cancer management. So we are looking forward for that. So make some time often and kindly, share your knowledge, sir. And I also thank Shakuntala madam, who is the founder of Ross team. And I thank Geeta Pottur madam for anchoring the entire session wonderfully. Dr. Geeta Jaswal madam for giving a good start for the session with a beautiful prayer, and Dr. Naina, who gave a detailed introduction of Dr. Satyan Bhatt sir. And last but not least, I thank all the audience who attended the session, who stayed with us throughout the session patiently, who are so much enthusiastic to learn. Thank you once again, everyone.
Thank you, Dr. Amulya. If any queries are there, they can post it in the group so that we can answer later. Now we are running out of time, so that's why we are closing the session. Thanks, sir, once again. Thank you. Please, Ross members, stay over here. Others can leave the webinar.